Does it feel like everyone has ADHD these days? Attention deficit hyperactivity disorder is getting a lot of attention these days. There are tons of influencers on social media who talk about their own experience navigating life with ADHD. There are even quizzes circulating on social media sites.
If you put 5 fingers down, you have ADHD. Put a finger down if you leave things half open, like cabinets, drawers, or doors. Put a finger down if you've ever focused on something for hours and don't notice the time passing by. Put a finger down if you often forget things. Put a finger down if sometimes you just don't eat.
Obviously not a medical diagnosis, but I would bet some of you are nodding along. Today on Blue Sky, we're talking about the impact of this kind of awareness of ADHD on social media. We're going to hear from a Saskatoon psychiatrist. We'll also hear from a Regina woman who has created support groups to help people navigate the emotions that can come with the diagnosis. But we also want to hear from you. And I want to be clear, we are not giving out medical advice today. Your doctors are still the best person for that. The internet, also not a doctor. We're talking about how ADHD is affecting people's lives and how treatment for it or developing coping strategies has really changed things for some people. So if you've recently been diagnosed with ADHD, I'd love to hear from you. Maybe your kids have been diagnosed. What made you want to seek out that diagnosis and how is it affecting life now? Call 1-800-716-2221 or email us bluesky@cbc.ca. So adult ADHD is the topic of our most recent This is Saskatchewan podcast. In it, our producer, Nicole Huck, spoke with psychiatrist Dr. Stefan Brennan in Saskatoon. So we're going to hear excerpts from their conversation throughout the show today. And joining me in studio is someone who is here to share about their own personal journey with ADHD and how they're using that experience to help others. Alana Boyle is a counselor in Regina who specializes in late diagnosis ADHD. She is with me in our Regina studio. Welcome to Blue Sky.
Thank you.
Before we get into your experience, I'd just like to start by playing some of our most recent podcasts so we can get a sense of just how prevalent ADHD is. So our producer, Nicole Huck, spoke to Dr. Brennan and asked, do we really have more cases of ADHD?
I think there's probably a multi-layered answer to that question. I would certainly say if you look at the data that we've been able to gather, the prevalence of ADHD is going up. So it is being diagnosed more. I think people who have worked with ADHD or neurodevelopmental disorders for some time would say that we are probably diagnosing ADHD more and hopefully diagnosing it more effectively. So whereas there may have been many more undiagnosed patients in the past, we perhaps are diagnosing more, particularly adults with ADHD now.
Do you have a sense of just how many, like what's the percentage of the population, anything like that?
Yeah, and we'll probably always look at sort of United States data or Canadian data if we can. You'll often hear sort of like a prevalence rate of between 4 and 5% in the population, though that number does appear to be increasing. And as far as sort of the best Saskatchewan data I could find from the Student Wellness Center at the University of Saskatchewan, they reported that 7.3% of their university students, which is a common population for ADHD, have been diagnosed with ADHD.
So off the top of the show, we heard that TikTok ADHD quiz. It's not just quizzes and diagnoses. It's a lot of folks with lived experience sharing their journeys. Alana, are you on TikTok?
No, I'm not.
You're on Instagram, though.
Yes, I'm on Instagram.
You've seen the ADHD quizzes.
I have.
How many of them have you done just in your head?
Not many. I try to stay away from them, quite honestly.
But would you put your fingers down for them?
Oh, yes. Yeah.
Why is it you try to stay away from them?
Because then I get too consumed by them. They're just, yeah.
And that's a product of your
It's
ADHD.
a product. Yeah, it's my ADHD. And I also, because people with ADHD often, they hyper-focus, they do those things, but they also have low, frustration tolerance. And so like some of that information isn't always accurate
Correct.
for people, right? And so if there are those pieces, then it's making me mad and I don't want to have to regulate myself just from a quiz.
Nicole asked Dr. Brennan about the role social media has played in raising awareness and reducing stigma. Let's take a listen.
Yeah, I think, lived experience in mental health is increasingly something we recognize as important, and that's not just ADHD, that's in, mood disorder and schizophrenia, psychosis, and addictions, sort of all areas of mental health. I think certainly social media, there has been a lot more attention paid to ADHD, and so when they track Google searches, they look at people who are, trying to look up this. Probably social media is amplifying the message a bit. And I would say that's not always necessarily a bad thing because, of course, as I probably indicated before, previously, like when I started working with adult ADHD, it was very, very underdiagnosed, and people often didn't know where to go or how to start looking at attentional and concentration and focus and hyperactivity issues because they were an adult. So some of this has been positive in that it's directed people towards seeking care. Of course, you have to look at the source where it's coming from, though, like how reliable is this information, and that's where the challenge sometimes is.
Yeah, when you heard that clip earlier about, put your finger down if you have misplaced something, and what are your thoughts as a doctor, as someone who knows what's going on? What were your thoughts listening to that?
Well, I actually hear clips like that all the time as I have a 9-year-old son, and he's endlessly finding things on YouTube, TikTok, and I'm used to hearing that voice in the background, asking questions. So again, I would not say that's like a reliable or valid screening tool. I would sort of kind of question about, what is the source here and what are they using for that information. But I would certainly say that increasingly patients that we see that are being referred to us are, kind of coming in, for example, having done something like an ASRS, like an adult screening tool, and saying, I think a lot of these symptoms apply to me, and I think this is something that I need to investigate further. But again, TikToks like that, maybe not the most reliable source of information when you're going to see your physician or healthcare practitioner.
Understatement of the century. Our guest today is Alana Boyle. She is a counselor here in Regina who specializes in late diagnosis ADHD. And that was Dr. Stefan Brennan speaking with our Nicole Huck. Alana, let's talk about your own journey to ADHD because sometimes it takes one to know one. But it took you a long time to seek diagnosis. How old were you when you were diagnosed?
I was 38.
And what made you want to go then to go get a diagnosis?
Well, I feel like that was quite a few years ago when we didn't even know about ADHD we do now. And so my diagnosis came from addiction issues, addicted to alcohol and drugs, coming clean, right? Going through recovery. And then my mental health took a dive. And so depression, anxiety, I was off of work. I was a counselor at the time, so I kind of understood what I needed to do, how to help myself, and nothing seemed to be happening. And I was referred to a psychiatrist, and at that time, he and I chatted about it, and that's where we went. And ever since then, I was fortunate enough to have a great psychiatrist, get put on the right meds, and everything just worked for me at that time. And so it wasn't seeking it. It was like the answer to what had been going on for me for years.
Does it explain how you were when you were younger?
100%. Like, I know we kind of talking about like adult ADHD, but you can't have ADHD unless you were born with it, right? And so it's something that it checked off a whole bunch of boxes for my behavior as a child or my behavior as a teenager or my 20s and all of those things. It made sense to me. It was like, this is what was missing.
Let's talk about those behaviors because I think there is a stigma, particularly around kids. And I think back to, I think we're probably similar-ish age. ADHD was not really diagnosed in kids. It was for some, but not for all. And in a lot of cases, those were the bad kids, the kids who couldn't sit still, the kids who spoke up when they weren't supposed to, the kids who were blurting things out, causing a distraction, all of the things now that we know could be symptoms of ADHD. But what was it like for you as a child and those behaviors, and how did they evolve over your journey through it?
Well, I think it's important for us to look at, like, it was primarily boys that were diagnosed back then too, right? Like, and so for girls, it's so much different. So being a female, like, it was more like daydreaming. I'm very competitive. I played a lot of sports. Those are actually, they also align with ADHD. I didn't study. I didn't know how to study. I couldn't, I only did the things that I was interested in. There was so many pieces, and there was always like more of an inner restlessness, or like the impulsivity piece. If people wanted to go and do something, yeah, I would do it. I'd be all in. And then there's the pieces that people don't necessarily look at, more in the caretaking, people pleasing, like lack of boundaries. There are so many other, like,
Perfectionism?
Oh, yeah, exactly. Being creative. There are so many things that we can get. Low self-esteem is a huge one, actually. There's so many things that we can get praised for that align with an ADHD diagnosis. So it's not always like the bad child or the one acting out or the one that can't sit still. Maybe they do have excess energy, but they need to do something else, right? So
For people who have mental health, or I will call them brain conditions, brain issues, things that affect their brain chemistry, in my experience, in my own mental health and those around me, a lot of coping is done through humor. Mm-hmm. And we see a lot of that on social media. Is that a double-edged sword, the comedy and the if it's used appropriately but not, and how it affects other people?
Yeah, 100%. Like, I still do it for myself, right? Like, because like if the room gets too tense, I use humor or the sarcasm pieces, which can hurt people. You know, like there's so many. Yeah, humor it's great, and it can be healing. The laughter piece of it is healing, but there can be when we look at it from a teasing standpoint or just minimizing those hurts, it can be very detrimental to people.
Is it helpful or hurtful to the stigma around ADHD to have the humor and the awareness on social media?
I believe it's hurtful, right? Because there's so many people out there that they are impaired. Like ADHD can really impair people. So like for me, I have tons of financial, like that's where one of my biggest impairments are. So if we're making jokes about those things, that just, again, it just brings up those old wounds of things that I've had to work on and try and change, right?
The impulsive spending side of things.
Right. Like even retail therapy, or because of my addiction, and we talk about, like lots of people talk about wine and all of those things, and it's meant from a good place, but for not everybody does it land that way, right? And so it can be very hurtful, especially people who aren't understanding their own ADHD or their own mental health struggles.
What changed for you after you were diagnosed?
Oh my goodness. I'm a total different person. So I always tell people, so like my addiction recovery has looked different. And I've always said, like, I quit about 18 and a half years ago, but I had relapses. And as soon as I started treating my ADHD, I no longer crave alcohol or drugs. I've been able to, I have my own business now, which wouldn't have been a thing. I was able to create boundaries and understand boundaries. Just the financial pieces, still not great, but understanding and knowing where I'm spending those things. And then my emotional regulation piece is one of the hugest things. Like I used to fly off the handle on so many different places, but understanding that. And then the self-esteem improvement, right?
So it changed a lot of your relationships then with people too.
Oh, yeah.
Not just with yourself, but with everybody else. So we've been talking about the social media popularity of ADHD, because it is, and maybe I'm just on ADHD TikTok and Instagram, and that's just the world I live in. But I do have some friends who've read the book ADHD is Awesome. It's written by a really well-known guy on social media, Penn Holderness of the internet's Holderness family. You may or may not seen some of their funny videos. Penn has ADHD, and he put out a song. Here's some of it.
Do you leave your phone and keys and wallet somewhere close to food? Like in the pantry by the chips or in the fridge?
Dude.
Yeah, 'cause food short circuits your executive functioning. did you come up with an idea that no one's ever thought? Because most great inventors have the same brain that we've got. Are you really good at making people laugh in comedy? You might have ADHD.
What do you make of the song?
I actually, for my Scattered and Beautiful workshop, actually have used one of their songs before because you know, when you look at songs, and this goes back into the humor a little bit too, right? Like using it in a healthy way in that sense is it does feel, it connects people, right? And so like that piece is really important in that connection. But we have to remember too, and this is the counselor piece of me, right? Like that everybody can forget things. Everybody can do those things. It comes back to when it's impairing your life and it's impacting you negatively, right?
What about the masking situation? Because while it can impair your life, it also can look outwardly like you're fine.
Yeah. 100% it outwardly looks like you're fine.
What are some of the ways that people mask ADHD?
Just people who have ADHD are very chameleon-like, right? So in any situation, they can like say you're a little kid in school and the teacher wants you to sit at your desk. Well, they're stopping everything from like them like speaking out, or like they can have bathroom issues, all of the things. Like maybe they need to get up and move. And because they're masking, they're holding themselves into that desk because they need to be perfect. They need to, you know, do those things. So it can impact you negatively in so many ways. And that's where like lots of people with ADHD will end up having different types of issues with like constipation, bladder, all of that stuff. Like masking is hard on an ADHD person and very exhausting.
I would say it sounds like you're having a lot of internal conversations with yourself.
Yeah.
What does it take to take the mask off?
A supportive environment.
Is that people? Is that medication?
That's everything. I think it could be everything, right? And I'm pro medication in the sense that it worked for me. But if somebody was to come to me and they don't want to take medication, or maybe they don't want to have it for their kids, then we look at other ways, right? So it's like having all of those pieces, educating people. My groups and the things that I do with clients is often like it's educating, because you need to know how your ADHD is impacting you.
Do you encourage people to tell people that they have ADHD?
If they're comfortable with it.
Does it help if people know?
No. Because
interesting.
it's stigma.
Right.
Right? Like if I was to go somewhere, if I was working somewhere and I said I have ADHD, they're like, well, okay.
And they don't necessarily know what that means.
They don't know
either.
what that means.
Okay.
And that goes back to like, there could be 5 people sitting in this room with us right now, and we could all have ADHD, and it could be impacting us differently. So we might all have different needs, right? And so like that's where it's like important to like understand like whether it's a student or whether it's your spouse or whether it's, you know, a friend, what they might need in different situations.
If you know someone has ADHD, do you bring it up? Do you ever talk about it? Is it like a conversation you have, or do you avoid
like
the
if they're not
conversation?
diagnosed and I think they have ADHD?
you see one across the room and you're like, I know you have it. No, I mean, if you know someone has it, do you check in with them, or do you ask them about how it's going, or do you just, is it a topic of conversation for you?
Oh, I talk about ADHD all the time. I let people come to me if they want to talk about it, because I don't want to intrude. I don't want to like impose in that way, right?
Okay.
If you again, I guess it goes back to depending on the person, because again, there can be communication struggles, there can be processing struggles, there can be all these things. So if I know it's somebody who likes to talk about it or may want to talk about it, I might probe it a little bit. But otherwise, I just let people, because I can get super passionate and go on and on and on about it. So it's like,
a fixation, if you will.
Yeah, maybe.
We have this email from Pete. It says, as someone who was diagnosed with ADHD since I was in grade 1, I hope y'all talk about the stigma we have had to deal with for decades. I was punished more often by teachers. I was treated differently by students and my friends' parents because of it. And I hated that I had to take medication, Ritalin. I didn't like how it made me feel. It took away who I was as a person. I felt like a robot. On top of that, you now have people joking all the time, oh, I just have ADHD, haha, or TikTokers who make a living off of it, whether they're raising awareness or not. I'm glad more people are being diagnosed and it's becoming more normalized, but it's still a bad feeling to see it become a running joke and a public spectacle when you had to hide it and feel guilty about it your entire life.
And that's what I said about like especially for boys, like years ago, it's stigma. They're the bad kids because they struggled to sit still, and they were the ones that were always signaled out by their teachers. And not to necessarily blame the teachers, but again, they didn't understand it. They didn't know how to support.
Things have changed a lot.
Yeah. And neither did parents. They didn't know how to support their child. They just wanted to stop the behavior that they had trouble managing or understanding. And we have to remember, like, ADHD is a genetic disorder, if that's what we're calling it. So it's genetic. So one or both of those parents have it, right? And so, like, that's where some of the difficulty comes, right? Like, you just want your child to behave. You don't want them to make, problems for you at home or at school or
both. Yeah, for sure. Hi, I'm Sam McKegg, and we are talking about ADHD today here on Blue Sky. Whether you've been recently diagnosed, maybe you were diagnosed as a child and this has been your whole life and you're watching people talk about it more and more openly. Maybe you have feelings about that. Give us a call, 1-800-716-2221, or send us an email, bluesky@cbc.ca. I want to bring in our other guest today. Sierra Giesbrecht was recently diagnosed with ADHD. She's 32, lives in Saskatchewan. She's a mom and content creator and makeup artist. And like many people, she started thinking about it when she was getting her daughter assessed for ADHD. Have a listen.
ADHD in women or girls oftentimes presents a lot differently than we see in boys or males. So a lot of the times we are looked at as maybe having anxiety, bipolar, those sorts of things. I was diagnosed with anxiety about 6 years ago when my daughter was 1 year old and have been taking medication for that. But I had also brought up some other points there about, compulsive spending or really I don't want to say manic, but extreme highs, or also lows of not being able to do things, but it wasn't necessarily depression. So I knew something was there, but they didn't diagnose me with anything further. But like I said, after my daughter was diagnosed a couple of years ago, going into grade 1, I really started to kind of understand and look at what some of these signs were and what her body was demonstrating. And I saw a lot of similarities between her and I. And some of those were, compulsive behavior. Sometimes that meant outbursts of anger. Sometimes that meant being hands-on. For me, growing into adulthood, a lot of the times it was compulsive spending and then having extreme remorse or guilt afterwards and going to return something. Having a hard time breaking things down into smaller pieces. I would have tons of amazing ideas and goals, but it was really hard for me to break those down into bite-sized pieces and to get things started to actually put things into motion. And I was also really noticing that I was very overstimulated at home, especially as I became a parent. I mean, little kids are very, demanding. They also make a lot of different noises. There's a lot of things going on. And I often felt like I was overstimulated or becoming angry from just random noises.
Okay, so Sierra brought up a lot of things there, and parents might be thinking, oh, that's me. I'm overstimulated and angry, or I have trouble putting my ideas in action, or I'm bad with money. Do I have ADHD? So Dr. Brennan, what are some of the most common symptoms for adults with ADHD?
Yeah, I think that was excellent because that's really not an uncommon story we hear to begin with. Parents with children who are starting to see a pediatrician, see a family physician, nurse practitioner, and they really recognize that a lot of the same symptoms resonate with them, or maybe did in their own childhood, their school years, their university years, or starting with work. And so, I mean, a lot of the symptoms that we do see that we would hear about would be difficulties with attention and maintaining focus, difficulties with being, very over-focused or hyper-focused when something really has a high level of interest, real difficulties with switching focus, like going from one task to another, completing a task and then being able to move on to something else. And then the sort of that distractibility piece, like, you need to do something, but there's something else that's much more interesting or exciting. So it keeps drawing your attention. And that probably feeds in perfectly to like the different types of ADHD that we see, in children, in young adults, and then in adult patients that I would see, that you can see the sort of classic hyperactive impulsive ADHD. You can see a lot of the core inattentive symptoms, which is, the difficulty with attending, maintaining focus, or really what we see a lot of, especially in adults, is what we call combined ADHD. And that just describes a symptom cluster of patients that have real problems with attention and focus, but then as an adult also have some of these impulsivity symptoms still. And that's the reality for a lot of patients.
Does it often run in families?
Oh, certainly. Yeah, there's a strong genetic component to it. Depends on the study you look at, that, 5 times more likely in family members, to run through. There probably is some genetic link with, we believe, some of our dopamine genes. And then I would like to say, too, like when someone's talking about a history of, I was diagnosed with anxiety, or I was diagnosed with depression, or I was diagnosed with a sleep disorder or another learning disorder, probably 80 to 85% of ADHD patients do have another mental health diagnosis. And that can be things like mood, things like anxiety, things like bipolar. Unfortunately, greater risk for diagnosis of substance use disorder. And again, probably some of that is purely biological as well.
That is Dr. Stefan Brennan, a psychiatrist in Saskatoon, talking with Nicole Huck. And they had that whole conversation on our latest episode of This is Saskatchewan. Does it seem like everyone has ADHD? Now, of course, not everyone has ADHD, but it's become more talked about because of social media. We got an email from Mike that says, can head injuries cause ADHD? Now, I'm not a doctor, but as we heard there from the doctor, it is genetic. But I think there would be a difference between ADHD and concussion symptoms. But I would also think that those things can overlap. The forgetfulness, the inability to focus, those kinds of things. But you're not going to bring on ADHD by getting a concussion.
The symptoms are going to, like you just said, they're going to overlap. People with ADHD are more likely to get concussions than people who don't have ADHD.
Tell me more about that.
That's pretty much what I know. But okay, so people with ADHD do, because part of it is because they are more involved in high risk behaviors or more involved in sports and those sorts of things. They're more apt to get concussions. So it could be related to that. I haven't done the research to see if it is related to just how the brain is developed to know if it's that in that sense. But yeah, people with ADHD are more apt to have allergies, like asthma, different things And then as Sierra was talking about, a lot of women, when they're going through puberty, they're going through pregnancy, they're going through perimenopause and menopause, that's when their symptoms heighten.
Flare, if you will.
Yes. That was actually the word that was in my head. But yeah, they will. They'll flare. And then again, they cause that disruption. And then they're more apt to have the mood disorders that follow along with pregnancy or postpartum. And yeah.
Interesting. Kim sends an email. It says, I was diagnosed with ADHD in my mid-40s. I'm 51 now. This was a life changer for me and explained so much about the hurdles I'd been experiencing my whole life. Once diagnosed, I was prescribed medications and was very reluctant to take it, but thought I would try it and see if it was helpful. At the end of my first day, I sat down and bawled my eyes out. My dishes were done. My laundry was done. I had fully taken care of my own hygiene needs, and there was no anxiety around any of it. I could not believe that I had a clean kitchen, food prepped, and all of the things that are supposed to go along with being a functional adult. I was overwhelmed on many levels. It was a relief, but also came with so much grief, realizing that if I had help earlier in my life might have turned out so differently. And it was a very emotional experience. And she goes on, that gave me goosebumps and that put tears in your eyes because it changes that much. And it happens, particularly for women, so much later in life.
Yeah. And that's often what women will say. Like I said, I create that group because I want the education out there. But so many women think they're crazy, and that's exactly why.
Or you're just diagnosed as anxious.
Yeah. And you still aren't able to do those things. You're not able to do the household tasks. You're not able to be the mom you want to be or be the person you want to be or manage all the things. And that is often the message you hear from women, exactly what you read to us, and that's where the importance is coming together and understanding and everybody having that awareness, whether it's at your job, whether it's in your home, whether it's as a person walking through life.
I want to talk about treatment because some people choose not to go on medication and try and cope with it in other ways, because the medications do alter your brain chemistry in a way, right? They make you function in a different way. We heard from Pete in that email. He felt like a robot. So Nicole asked Dr. Brennan how often people choose medication.
It's a good question. I mean, I think probably, again, you'll see probably about at least 60 to 65% of people with, let's say, more moderate to severe ADHD will be on some type of medication. And often the first line evidence-based treatment will be like a psychostimulant or a stimulant medication. So,
what is that actually doing to your brain?
Yeah, so it's interesting if you read, because ADHD is not new. You know, we've talked about this type of stuff for over 200 years. We started using amphetamines to treat these symptoms probably in the 1930s with hyperactive young boys, essentially. We used to call it a paradoxical reaction, meaning like, well, we don't really know why. You know, we're giving stimulants to people that are already hyperactive, but it works better, so that's paradoxical. That's not what we think is true, to be honest. We believe it's probably a couple of neurotransmitters. Primarily, we think dopamine, also probably something called norepinephrine. We think a lot of it has to do with what's called your frontal lobe or your prefrontal cortex, so the very anterior part of your brain, which has a lot to do with what we call executive function, so sort of like planning, sequencing, and working memory. So we think that these medications are probably working on these kind of hypoactive areas of parts of your brain and helping you to regulate a bit better. However, I'll be honest, I'm not giving you the definitive science of this. It's still something that we're actively researching for targets.
And I want to talk about the difference that drugs can make for people. So Sierra, the mom from Saskatchewan, decided to go with medication.
I've been on Concerta consistently for about the past month, and I have seen some changes. Definitely a little bit more focus for me and being able to handle those overstimulation pieces a little bit more. But it also gave me some validation for how I was feeling when I was growing up, and why I was the way I was. Because oftentimes kids with ADHD are just labeled as bad, troublemakers. They're not successful in school. They're mean or angry, but there's so much more to us, and our brains just work so much differently. So it really gave me that validation that like I finally kind of understand my brain a little bit more now.
So she went on to say that the diagnosis for her daughter and her gave her the ability to be a little bit more empathetic with her daughter and maybe even cut herself some slack. So I can see the benefit of a diagnosis in her case, but the drugs are tricky. So since Sierra recorded that, she's since changed drugs. The first drug she switched to gave her major depression. She switched again. I mean, it's not just like a one-stop shop for people. I feel like it's a bit of a journey. What kind of side effects might go along with ADHD drugs?
Yeah, and so again to give you a number, probably we hope that about 80 or 85% of ADHD patients will see some benefit with a frontline medication like a psychostimulant. You know, we'll see clinical and valid improvement in their lives. How do we treat with these medications? Start low and go slow. I've certainly found this in my clinical experience. If you overshoot, if you start too high or increase too quickly, you can give people side effects which unfortunately are uncomfortable, sometimes make them lose confidence that these are, the right medications are a good choice for them. So we spend a lot of time on psychoeducation, and maybe I'm lucky, I'm a specialist, I have time to, talk longer to patients than, 7 to 10 minutes. But I talk to them about things like appetite suppression, which can certainly happen at the start. So about planning eating. I talk to them about the importance of sleep and sleep hygiene. I talk to them about the possibility of things like headaches or muscle tension, about the possibility of noticing some increased heart rate when they're first getting used to the medication, and that these are all normal things. But that if we, again, sort of agree on a plan, start low, and kind of slowly titrate up to try to get to an effective dose, we're likely to have greater success. Again, patients, it's probably genetics. It would be great to say that everybody responds to the same medications, but they don't. Maybe about 50% of patients will do with either what we call methylphenidate, so a Ritalin-type medication. Will also do well with like a dextroamphetamine or dextrin-type medications, but some are really selective for one or the other, and we end up having to do switches.
What was your medication journey like?
You know what? I was very fortunate. Like I said, we
Did you get a med and it stuck and it worked?
yeah.
Oh, you were lucky.
I was super lucky. And like I said, I have a great psychiatrist. Him and I communicate very well on the medications and how I use them, right? I'm in perimenopause now, so sometimes they work, sometimes they don't. And so we write the prescription that works for me. And so I've been very lucky. But medication is so tricky because we've never switched meds. But the pharmacy will tend to give you the generic kind instead of the brand name kind. And so if I take the generic kind, it doesn't work.
Oh, okay.
Yeah. So there's so many pieces of medication that is so important that you don't know unless you're in it and asking questions and advocating and doing all of those things.
I want to go to the phones. Patrick is on the line in North Battleford. Patrick, go ahead.
Hi.
Hi.
I was diagnosed with ADHD later on. Well, not really later on in life. I was in my early 20s.
Okay.
The reason that I actually got diagnosed was because my mom got diagnosed. And so, I have ADHD. My mom has ADHD. My daughter, when she was 4, when she was 2, she started showing signs. Thankfully, I have a neurotypical spouse who loves doing research, and she read a lot of books. She gave me a lot of books to read, even though I wouldn't read them. So my daughter, she's been diagnosed since she was 4. Now she's 7. My mom and I are both medicated, and it's taken us a long time to get to the whole low and slow thing.
Mm-hmm.
It takes a long time to get your meds right. Well, it took me a long time, anyways.
What difference did it make for you? Because you weren't expecting to be diagnosed, but then your mom gets diagnosed, and you're like, "Holy moly, I might have this too." How long did it take? What difference did it make for you once you realized that this is why I am the way I am?
Well, it answered a lot of questions of my youth, and how I was that kid that the teachers always pointed at.
You were the bad boy.
The kid who always and so as soon as I got diagnosed and got medicated, it was a completely different world. Actually, I had a friend who was I didn't know he had ADHD. And I opened up to him, and then he opened up to me, and we sort of had a lot of conversations of like, "Hey, did you do this?" Yeah.
Now, watching your daughter grow up with this, do you have that in that email Kim sent us? She talked about the grief that comes with knowing, man, my life could have been so different. Do you have any feelings like that?
Oh, absolutely. I'm really glad that we had her diagnosed so early. We're doing our best to keep her off meds as long as we can. Some days it's easier than others.
Mm-hmm.
It was, but yeah, it works a lot better knowing that she's diagnosed, and gives us a lot more things that we can work on for like coping mechanisms for her.
Patrick, thanks so much for sharing this with us today. I appreciate it.
Thanks.
You hear his story. He was diagnosed almost 20 years before you were. What difference would it have made for you 20 years earlier?
Well, I probably wouldn't have had addiction issues. I probably wouldn't have failed university stuff. I probably would have had better marks in university. I would have had less accidents, less concussions, less... There's a whole bunch of things.
So you have that grief too that Kim talked about in the email. Or have you moved
I
past
actually,
that?
you know what? My grief wasn't grief like most people talk about it. It was anger. Like I was mad at the world. Like why couldn't somebody have done this? You know, and it wasn't always or often. It wasn't super intense. Well, it was super intense, but it wasn't long lasting. But I did have more anger than the grief, right? Because I also ended up looking at it, and this might have been the work that had done at that time, was that if I didn't have that path, I wouldn't be able to just support and do the things that I do now, right? So if I didn't have all of those complications or those different journeys that I took, I wouldn't be able to support people in that way or the same way. And but there was definitely some anger, but lots of people do feel that grief, and sometimes it's super heavy and deep for them because depending on when, you know, or what had happened, because marriages dissolve because of ADHD. Like there's so many things that happen in people's journeys when they don't understand or don't know that they have ADHD. Like, and people die younger because they have ADHD and it's undiagnosed. Like there's just so much. And so, yeah.
Okay. We know ADHD is often not a lone wolf in its diagnosis. I'm going to let Dr. Brennan explain that one.
ADHD is an illness of comorbidities. I really, seeing adult patients, I'll be honest, it's quite rare that they just have a pure ADHD diagnosis. They've often been assessed for a lot of different things. As I said, depression, bipolar, anxiety. They may have sleep issues. They may unfortunately have had some substance use issues which have been identified. They may have other learning disabilities that were diagnosed when they were younger, for example. So, you know, the pure ADHD patient, to be honest, is actually quite rare. It's very common that they have other comorbidities. And sometimes it's a big challenge for us is what do you treat first? And of course, often you treat the most disabling thing first, like if they have severe depression or anxiety. But by the time they're seeing a specialist like myself, often they have been, you know, diagnosed with a number of other things, have been treated for it, medications, counseling, you know, groups, self-help approaches. And sometimes they're quite frustrated, of course, because, you know, the ADHD is the part of the picture that just hasn't really been identified or treated.
Alana, in your case, you went in for other reasons, mental health, and came out with an ADHD diagnosis. In the people you're supporting, in support groups and as a counselor, do you find that people are being diagnosed with a whole host of things at once? Or do they go in for one thing and come out with friends? I call them friends. But you know what I mean? Like, how does that work for the people that you're supporting?
Especially women. It's more so in women that you'll see the anxiety, depression diagnosis, which are actually symptoms of ADHD. So they can stand alone, but they are technically symptoms of ADHD. And then there's also, like for men, it usually is the substance abuse, you know, or addiction issues. So yeah, there is usually all of those things. And the ADHD can also get missed. Like I know lots of people who, like ADHD and dyslexia are a huge comorbid situation, right? And so it doesn't, like the doctor was talking about, it doesn't have to just be like a mental health. It can be like other learning disorders or whatever. So like even processing disorders, reading and math, you know, and so like all of these things combined can create such complexities, you know, and complications especially in a young person's learning, right? And so like that's where I advocate, like if we can learn a little bit more about some of this stuff, then we can help their, like just their self-esteem and their self-worth in general is a huge piece.
I think we underrate how important the child's confidence is.
Yes, 100%.
In general, like in learning and how they feel about themselves and their relationships. And I think that this is a piece of that puzzle. We got a voice note from Sarah. She's 41. She was diagnosed with ADHD in the last year. And this is what she says about her diagnosis and what it's meant for her.
I would say since determining that I do have ADHD, that it has helped explain a lot of things that just sort of that anxiety and depression never really explained properly. And now that I have the proper framework for understanding the way that my brain works and some of my behaviors, when some of those things are problematic, I have a much better idea of how to manage them or cope with them in a healthy way. It's nice to learn that, you know, if you're dealing with things like anxiety and depression, sometimes you feel very alone, even though, you know, the awareness around those things is much better than it used to be. But really like the analogy where, if you figure out that you're neurodivergent, which includes things like ADHD and autism, suddenly you realize that you're not a failed horse, you're a zebra, and you've been a zebra all along. There are other zebras like you, and you don't need to try to be a horse anymore. So I really like that analogy. I think it helps explain it really well.
And no zebra's stripes are the same.
No, not at all.
Alana, as we're getting close to the end of the show here, I was wondering if there's someone listening who thinks and is sitting there doing the spiral of, I might have this, but the idea of even tackling it overwhelms me, what advice would you have for them?
That's actually a hard question. I often just tell people, like, I very much am willing to support people and help them navigate systems for them, right? Like, so if they're going through some of this stuff, like, they can email me or message me on Instagram or something like that, and I can help give them some tools of which way to go for that. But it is having those conversations with your doctors or your support people or your counselors or whomever, and maybe even talking to your family, because somebody could have been diagnosed. I've had many clients that were diagnosed as children but didn't even know they were diagnosed until they're like adults and talking to their parents about it. And they're like, yeah, you were diagnosed when you were in grade 2 or whatever. So, it is having conversations with whomever and not always believing the social media pieces. Yes, they give you some information and can help guide you, but...
Well, thank you so much for sharing your story with us and for your time today.
I loved being here. This was fun.
Oh, I'm so glad. Okay, we've been joined in studio here by Alana Boyle. She's a counselor and life coach in Regina who specializes in supporting people on their ADHD journey. You can find her on Instagram. We've also been hearing excerpts from a conversation between our producer, Nicole Huck, and Dr. Stefan Brennan. He's a psychiatrist in Saskatoon who diagnoses ADHD. You can hear that entire interview on This Is Saskatchewan, wherever you get your podcasts. So please go check that out and download our latest episode. And if you love it, please share it with a friend. Before we leave you, we're going to send you out with a little more of that song from Pen Holderness. I'm Sam McKeag. Thanks for listening.